Good evening, Dr. Surya Elangovan. Congratulations first on getting rank 42 in NEET SS 2023. So you must be feeling really great.
Yes, sir. Yes, sir.
So tell us a bit about yourself. I think you are from Tamil Nadu.
Yes, sir. I am from Tamil Nadu, sir.
So
Sir, actually, Vanakkam. Vanakkam. Sir, actually, I did my undergraduation from Kanyakumari Government Medical College, Tamil Nadu, sir. And I did my post-graduation in Maulana Azad Medical College, batch of 2019. So I am working as a senior resident in Maulana Azad Medical College.
great, great, great. So you have done really something remarkable. You know, Kanyakumari is a recently launched college. It's one of the newer institutes in Tamil Nadu. Going from that to MAMC itself is a great journey, and you've done that and being an SR there. And now you must be really on top of the world, being All India rank 42. So tell us about your experience. How did you start? How did you get into this NEET preparation? Give us a few things that
Sir,
you have done.
yes, sir. Actually, during my PG time itself, I had already decided that I'll take 1 year of break to do senior residency. So in that time, I thought I'll add on to my NEET SS preparation. So I just wanted to I have the idea of the exam. So I gave last year NEET, and I got a decent rank of 800. So which I was not interested in getting. So I thought I wanted to see what are my fallacies and what are my points that I had to look into it. So during my PG time itself, I used to read Sebastian, sir. So I gathered all my important tables and important figures, and I screenshot them and I keep it with them with myself, so separately, so that if I had to recall or revise, that would be better. So after joining as a senior resident, this new edition Bailey came, sir. So from reading from 27 and to updating with 28, that was a bit cumbersome, and it was also a bit easy as well. So I added on what all I could read from 28th edition Bailey. So that is how I had to manage. And that is how I came up here.
So very good. So, like so many other people who have been toppers in the top 100, I find that you are also taking, Sebastian as your base book with additions from Bailey, especially the new edition. So, how did you find the examination? Like, many people actually said it was much different from whatever we have written before as far as NEET is concerned. How do you feel the exam was?
Yes, sir. This year NEET, I feel it is a bit difficult compared to the previous year NEET. And the questions were like clinical oriented, and some were straightforward one liners were also there with the level. I felt it was somewhat difficult, but I thought it is, if it is difficult for me, it should be difficult for everyone. So I was like, it's okay to be difficult rather than to be have an easy exam and everybody is stopping up and somebody is getting pulled up. So I was happy by that way. The exam was difficult for everyone, so let it be. That is what I felt after giving the exams.
That is very absolutely right, Dr. Surya. I mean, this is a very important point. Many people actually, whenever you have a difficult exam, the tendency is to get let down and feel, oh, I've not done well and all that. But usually, I feel that,
Yes.
this is the time when actually the people who have put in the preparation will come out on top. So, for the people who have prepared, it's not really important how the exam is. If it is a tough exam, actually, they do much better than other people. As you say, in an easy exam, even one small silly mistake and send you back by 100
Yes, sir.
ranks or 200 ranks just like that, whereas this one it's very difficult because
Yes.
most people will not be attempting blind. Okay, so how did
Yes.
you actually use doctor tutorials in the preparation, and how was it useful for you overall, because you seem to have already gotten the basics right? So
Yes. Actually, I use doc tutorials, question bank, and test series, sir. So, like every week, grand test was a very much important thing for me, because as a senior resident, I didn't get much time to practice my MCQs and this thing. So every day, the exam was on Sunday after 12 o'clock. It used to come. So I used to make my time so that I don't miss out this exam. So I used to appear even if I don't read, or if I read, I'll appear for this exam, and I used to see how my progress was. Like initially, my scores were like for around 60% of the total mark. I used to be there, and I used to see the rank list. That would be very depressing for me. But every week, I used to like this week I will appear this thing. I will improve this much questions. I'll strategically skip these much questions. I used to appear there every week test was very useful for me, and the question bank was very elaborate, sir. And it was like I had to solve like more than 150 questions per day to keep up with the number of questions that are there in the question bank. So I was not able to complete the full question bank, but at least 70% is what I was keeping a target to finish before the exam. So that was like it was a very elaborate question bank to finish. That is very unlikely for me to finish, but I try to finish at least 70% so that I am a bit confident while going for the exam.
That's great. This is something similar to what the previous candidate was also telling in the interview. Using the question bank will give you an update of how you're performing, and you try to improve. As they say, every 1% of improvement that you keep on adding is still going to translate to something. So that point one, if you say, that improvement is also going to add on to finally the result, which is going to be much better than doing nothing at all. And that is what you have been doing. Perseverance is the key, and that is very important
Yes, sir.
for this one. So, what is your field of interest? What subject do you want to take in this counseling session that is upcoming now?
Sir, I am planning to take surgical oncology as my MSH, MSH
Great, great.
residency, sir.
I find that this year there is a lot of preference for surgical oncology. Usually it will be gastro first, and then onco will be there. But I think I was actually surprised yesterday also in an interview where four people were there in the top, 15 or 20, and almost, there were two who said surgical oncology. One person was urology, and one said surgical oncology slash urology. I was actually very surprised to see nobody actually saying gastroenterology. There seems to be a reversal of trend. I actually thought again, because you did from MAMC, there is a lot of preference for surgical gastro. MAMC is where people are trained for surgical gastro. So I was thinking maybe you will be thinking of that as well.
Yes,
So great, great, great.
yes,
So
sir.
excellent.
But in my
What?
unit, we do more of a,
Yeah, please
sir.
go ahead.
Yes, sir. Actually, in my unit, we do more of oncological cases as well. That is what is a more of trigger to pursue surgical oncology.
Great. Very good, very good. So I'm sure at your rank you'll be getting almost all the top institutes which are available to you, and that is not going to be a problem at all for you. So other than the question banks and this one, so this is one thing which you said, taking snapshots of all the important tables and everything is very important, and that is something that we also stress upon at Doctor Tutorials as a team and as a group of faculty. So which who are the faculty who have kind of like impressed you, and I'm sure you would have seen some of the superovers and all that. So how were they useful? Because a lot of people commented on that. And
Yes, sir. Actually, this quick revision protocol questions and the topics and this super over videos were very informative, and it was very triggering for me to read more and more and more, and like positivity was there after seeing all these videos, because to look into my exam scores, and after seeing these videos and this, like they were like this is how I had to approach the questions, that were all like very useful and very interesting for me. So that helped me during my I used to see all these videos during my emergency time, or whenever I get time during my work residency times. So that is when I had to sandwich all these videos so that I don't get demotivated. That is how I wanted use, and that is how I used everything.
yes, because as postgraduates, when you are doing it and at the same time you have to prepare for it, it's definitely not easy. A surgical residency program is always tough. You'll have night calls, you'll have duties, and irrespective of that, we'll always stick around in the ward, in the OT, most of the time as surgeons. So, it's really motivating to see so many youngsters trying and attempting and getting through. It's like almost everybody is getting either in the first or the second attempt. And very commendable. You've got a good rank. I mean, 800 is a pretty decent rank. Many courses would have been open to you, but you were very clear in your approach, saying that no, I wanted to do this, so I'm just taking a shot at it again. I'm going to sit down and prepare. So how long did you take off for preparing? Like how many months, or were you continuously working even towards the end?
Sir, I continue to work till the end, sir. I am still working as a senior resident. So I wanted to work actually because 1 year we lost it in COVID. My surgical residency program was lost in COVID, so I was very clear I should not lose this 1 year of residency program, and that too in a premier institute like MAPSI. I should like working as a senior resident was a very, very great opportunity. So I didn't want to miss that also, and I didn't want to miss this super specialty exam also. So I did work. Till the last year. I couldn't take break. I didn't take break also.
Wow, that is really commendable, Dr. Surya, because almost everybody, I mean, not almost everybody else whom I have spoken to, they've all taken a break of minimum at least a month before the examinations to sit down and give that last push. If you have been continuously working, I think you're still in the ward, so I can see that you got a list of postgraduates and this one and all that, the duty roster and everything behind you. So it's really commendable that you are doing it, and I think that's also a right way. Of course, I would recommend taking at least a month off before the examinations. That is what I would say as an advice to anybody who's joining, because ultimately you want to get into a postgraduate seat or super specialty seat so that you do this further. Uh, no doubt, I mean, MAMC, when you're doing it, it's really one of the premier institutes in the country, and you want to learn all that you can, especially when you've had some difficulties in your post graduation due to COVID. But still, I would generally say that it's probably better to take a month at least off in the last 1 month to sit down and really prepare for your exams. But that said, what you have achieved while still working, doing your surgeries and your duties and everything, and still getting all India rank 42 is, hats off. I would really say it's excellent. It's stupendous, so to say.
Thank you.
So, would you
Thank you.
like to credit somebody else with your this one, to pay respects to somebody, your family, friends, anybody whom you want to name
Yes,
as have been instrumental in your getting this rank?
sir. First credit I'll always give to my colleague, co-SR, sir. Actually, while doing my duties also, they used to send me from the ward. They used to take care of whatever extra duties that I had to do. They used to cover me up for everything. So that was very helpful for me, and it was very motivating for me, sir. And my friends also used to motivate me a lot to read, even coming back from the postings. So that was very useful and very helpful, sir. So I have a friend whenever I feel depressed, I used to call him and I used to tell him that I'm very much depressed. And he used to be a very backbone for me. He used to boost me up every time. Actually, he's an anesthetist, but he used to help me a lot with my depressive phase. So whenever I'm depressed, I used to call him, and he used to pick even while in the OT also. So that was very helpful, and he's always been a very good support for me, sir.
Friend in need is a friend indeed, and that is absolutely right, Surya. We all need that somebody. All of us do face a lot of struggle in our life as doctors. Not, I mean, other than doctors, I don't think people can understand. And there is a unique brand of depression which is common for surgeons, where their cases are not doing well, they've operated on somebody and it's not right or whatever. So then, of course, our usual things where we have a lot of work going on, family struggles are there, and this is something which a lot of other people will not be actually able to understand, except a friend like a doctor who can really understand what you're going through. And you're lucky to have such a friend, and of course your co-PGs who have co-SRs who have really paved the way for you in so many ways. I remember something similar happening to me when I was doing my preparation for all India and aims at the time when I was preparing for my post graduation. All of them used to kind of like, you go and study, it's not a problem, we'll take care. So I used to finish my work and go, and they used to take care of the duties and calls and stuff. So that is a great thing. So congrats once more. And what made you interested in oncology other than the fact that your unit used to do? Is there any special reason? Because many people get into oncology seeing somebody in their family or somebody close to them having cancer. So did you have any similar motivation for getting into it?
Yes, sir. As such, I didn't have any personal reason for joining into surgical oncology, sir. It is the satisfaction that we get after the surgery or the treatment. The patient is very much satisfied. I still remember a patient. I operated her in an emergency, sir. She came to me in subacute internal obstruction, tha. So I did a critical right hemicolectomy in the emergency itself, sir. Hello, sir.
Yeah, yeah. You're online. You're live. You can go ahead. You're live, Dr. Surya. You can go ahead. You can talk. Can you hear me?
Hello, sir. Yes,
Yeah,
sir.
you are live. You can go ahead,
And
Dr. Surya.
yes, sir, I can hear you, sir. Sir, am I audible, sir?
Yeah, yeah, you are
Yes, sir.
audible. You were telling about
And I
hemiplegia.
operated that case. Yes, sir. Actually, we operated her for a tubercular stricture with hemicolectomy, sir. But the post-op biopsy turned out to be a moderately differentiated adenocarcinoma. So when I told the patient husband, he was very much depressed and he was asking for like what is the progress and what is. And we had done a PET CT and there was no glow up. So we had sent her for chemotherapy, sir. So she came back after 4 cycles of chemotherapy and she was very healthy. And she came to me and she blessed me like anything. And like she was being she mistreated as a case of tuberculosis for 6 months. And when I took her for surgery and post-operatively, we found it was a malignancy and everything was a shock. But at least they got a diagnosis and she got treated and she was completely cured. And still, she comes to me in the ward just to show whatever is the problem, and she brings her whole family. Whatever is the problem, she shows to me only. Sir. I was very grateful, and I felt very. I was as a surgeon, I felt very proud that time. Ki I could treat someone full free of cancer. So that was very inspiring for me as well, sir.
That is really inspiring, Dr. Surya. It's very true as well because irrespective of whichever branch you are in, you will help people. That is no doubt. But cancer, especially oncosurgeons, when we deal with patients, we basically have to get their trust for life. It is like that. It's a lifelong relationship because you have to keep them on follow up.
Yes,
You have to keep doing checkups and everything. So it's a relationship for life. Most of us actually become friends with patients much more than, like, for example, you do the same thing for even like, if it had been a tuberculosis, you would have still done the same, but then such a patient would have been on follow up for probably 6 months or 8 months max till the time they are getting ATT. And after that, they will probably never come back to you unless there is an issue. Whereas a cancer patient, on the other hand, will keep coming back to you for follow up. And that is, that humane approach is absolutely needed. In India currently or through the world, the cancer cases are increasing, and we need young dynamic surgeons like you who are interested in surgical oncology. This is something which many students also ask. So whether there is a role for surgical oncology, so many subspecialization is happening and all that. But I can tell you very clearly that in our country, there are lots of areas where there is a requirement of a huge number of surgical oncologists, so that the subspecialties and all that. If you look at it again, some of the subspecializations are good, but then some of them are just an extension. They do a little bit more than what they are doing routinely. You can even talk to people like, for example, in many of my surgical oncology institute colleagues I talk to, they say basic cases are done by them in the other subspecialties. Some of the more advanced cases actually come back to us, so you become even more specialized at this. So that is how it goes. Like, Dr. Surya, are you online? Yeah, I think you came back.
yes, sir.
So in essence, this is a field that has got a lot of scope, so there is no need for any of you to worry. Of course, when you're coming to the cities, maybe you'll need to think about subspecialization, and that is sort. I mean, always it's good to be a little more defined. Like even in surgery, I've done this surgery as a surgeon, as a general surgeon, not as an oncologist, but still. You're doing the best for the patient, and that is what is needed. And when you become a little more specialized, you'll be doing more better. So, congrats once more, Dr. Surya, and thank you for joining us today evening, in spite of all your busy schedule and all that. And I'll be glad to help you out in any way whenever you are, wanting some help or support or any which way. All of us here at Dr. Tutorials and Team RRM are here to support you. And kindly get in touch with us for anything. You have the numbers, and you can get it from them and get in touch with us as well. So, congrats once more, and here's to wishing you all
Yes.
success in your career. Thank you.
Thank you, sir. Thank you, sir. That was very nice talking to you, sir.
Thank
Thank you,
you.
sir.
Thank you, Dr. Surya.